What's even more alarming? Cardiovascular disease is rising rapidly across the globe, and it's no longer just a problem for the elderly. Even younger people in their 30s and 40s are becoming victims. Many of the early symptoms are so quiet and subtle that they're mistaken for stress, indigestion, or simple fatigue. That's why the most important thing you can do today isn't to panic, but to learn how to recognize the early signs. If you notice any of the symptoms we're about to share in this video, don't ignore them. Don't wait. See your doctor right away, because it might be the final warning before a stroke strikes. Please stay with this video until the end. What you learned today could save your life, or the life of someone you love tomorrow. In this video, you'll discover 10 silent signs that your heart may be crying out for help. From unusual fatigue and cold sweats to a vague sense of anxiety. These seemingly harmless symptoms might be your body's last attempt to warn you before it's too late.
You are a doctor, a medical expert, presenting valuable health information to the audience to help them live healthier lives and avoid common mistakes. Sign 1. Extreme fatigue. Unusual or extreme fatigue can be an early symptom or warning sign of a stroke. Keep in mind, fatigue can have many causes, but stroke-related fatigue is often intense and persistent. It feels different from your usual tiredness and isn't linked to physical exertion or lack of sleep. For example, this kind of exhaustion may be related to changes in blood flow to the brain. It can be caused by a narrowing of the arteries due to atherosclerosis or a blood clot that disrupts oxygen delivery. If you feel an abnormal, unexplained tiredness, especially if it lingers, don't ignore it. See your doctor for a full evaluation. Sign 2. Persistently high blood pressure. Uncontrolled high blood pressure can dramatically increase your risk of stroke. Blood pressure is the force of blood pushing against the walls of your arteries. When that pressure is too high, it's called hypertension. Over time, this pressure can damage your blood vessels, causing them to narrow, weaken, or even burst. If a blood vessel in your brain bursts due to high blood pressure, bleeding can occur, leading to a hemorrhagic stroke. If high blood pressure damages the arteries that supply your brain, it can reduce blood flow or cause a blockage, resulting in an ischemic stroke. That's why it's crucial to know whether you have high blood pressure, and if you do, to manage it properly. Lifestyle changes and medication can help you keep it under control. This is one of the most important steps you can take to reduce your risk of stroke and other heart-related diseases.
Sign number 3. Vision problems. If you suddenly experience vision changes, it could be a warning sign of an impending stroke. Blurry vision, double vision, trouble seeing out of one eye, or difficulty focusing may all indicate disrupted blood flow to the brain. Loss of vision can result from a blockage in one of the arteries that supply blood to the eyes. Of course, vision issues can be caused by many other things, but that's no reason to ignore them. If your vision suddenly changes or feels off, seek medical attention immediately. It might be your body's way of signaling that something more serious is going on. Sign number 4. Transient ischemic attack, also known as a mini-stroke. Sometimes what feels like a momentary dizzy spell might actually be a transient ischemic attack, or TIA, often referred to as a mini-stroke. A TIA produces stroke-like symptoms, but they are temporary. They usually last only a few minutes to a few hours and then go away completely without causing permanent brain damage. This happens when blood flow to a part of the brain is briefly blocked or reduced. Even though the symptoms disappear, a TIA is a critical warning sign. It's a medical emergency because it strongly suggests that a full-blown stroke could happen soon, sometimes within days or weeks. Never ignore TIA symptoms just because they've gone away. Seek immediate medical care by calling 911 or your local emergency number. Prompt action can save your life and prevent permanent disability.
Sign number 5, numbness or weakness in the limbs. Sudden numbness or weakness in the arms, legs, or face, especially on one side of the body, can be an early sign of stroke. You might lose sensation or strength in one arm, leg, or side of your face. These symptoms may last only a few minutes or hours, but they should never be ignored. Even if it's not a stroke, it could still signal a serious neurological issue that needs to be investigated. When one side of your body feels different, sluggish, heavy, or disconnected, it's time to see a doctor right away. Sign number 6, sudden dizziness, severe loss of balance, or coordination issues. Pay close attention to any sudden onset of dizziness, especially the type that feels like the room is spinning, true vertigo. You might also experience a sudden loss of balance or difficulty coordinating your movements without any clear explanation. You may find yourself stumbling, unable to walk in a straight line, or struggling with simple tasks that usually require no thought. Although these symptoms can have other causes, if they come on suddenly, especially in combination with other potential stroke signs, they need immediate medical attention. This is not the same as feeling mildly lightheaded. It may be a sign that the part of your brain responsible for balance and coordination, such as the cerebellum, is being affected.
Sign number 7 is speech difficulties, or aphasia. One of the warning signs of a stroke is sudden difficulty speaking. A person may slur their words or begin to stutter. This is known as dysarthria. They may struggle to find the right words or form complete sentences. This difficulty in speaking, understanding, or expressing language is called aphasia. It can happen suddenly and may be very noticeable, even if the person was speaking normally just moments before. Sign number 8 is sudden confusion or trouble understanding speech. In addition to problems with speaking, a very important red flag is sudden confusion or difficulty understanding what others are saying. The person might seem disoriented, unable to follow simple instructions, or have trouble keeping up with conversations they would normally understand. This isn't just forgetfulness. It's a clear and concerning change in the brain's ability to process language or information. It may indicate that the language centers or cognitive processing areas of the brain are being affected.
Sign 9, other neurological symptoms. Whether it's a hemorrhagic or ischemic stroke, there may also be other early neurological symptoms. These can include sudden memory problems, unexplained nausea or vomiting, or a sense that something just isn't right. These symptoms may appear days or even weeks before a major brain event. That said, similar symptoms can also be caused by other conditions, such as seizures, low blood sugar, brain tumors, panic attacks, or infections affecting the central nervous system. That's why it's so important to consult a qualified doctor for a thorough evaluation when symptoms like these appear. Now you know, even a brief interruption in blood flow can bring you dangerously close to a stroke. Other risk factors include alcohol or drug abuse, obesity, poor diet, depression or anxiety, a sedentary lifestyle. All of these can trigger harmful processes in your body that may eventually lead to a stroke. In reality, stroke doesn't always come with warning signs. The truth is, a stroke doesn't always show any symptoms before it strikes. That's why prevention is absolutely essential. Here's how you can reduce your risk starting today. Control your blood pressure. Keep your blood sugar at a healthy level. Exercise regularly, at least 150 minutes per week. Even simple walking is incredibly beneficial. Eat fresh, nutritious foods. Avoid processed foods, excess sugar, and saturated fats. Manage your cholesterol levels. And most importantly, schedule regular checkups with your doctor, including your cardiologist. These actions can help prevent a stroke from happening in the future. And always remember, managing known risk factors, such as high blood pressure, diabetes, and quitting smoking, are some of the most powerful steps you can take for your health. Sign 10. Sudden and severe headache. A sudden, intense headache may signal an impending stroke, but it's important to understand not all headaches are caused by strokes, and not all strokes begin with a headache. In ischemic strokes, where blood flow is blocked, headaches can occur due to reduced circulation in the brain. When they do, they're often described as sudden and severe. In hemorrhagic strokes, caused by bleeding in the brain, the headache is often even more intense. Many people describe it as the worst headache of my life. Sometimes such a headache can indicate that a brain aneurysm is about to rupture. That's something you should never ignore. If you found this video helpful, please don't forget to like and subscribe to our channel. You can also help protect the people you love by sharing this video with them. Most importantly, if you or someone you know experiences any of these sudden symptoms, don't wait. Call 911 immediately. Time is critical when it comes to stroke. 10 silent warning signs 1 month before a stroke occurs. Did you know? The human body often sends out early warning signs, sometimes as early as 1 month or even just a few days before a heart attack or stroke occurs. But sadly, most people overlook these silent signals. The most dangerous thing about a heart attack isn't the sharp chest pain, it's the deceptive feeling that everything seems fine. And that false sense of security is the real trap. If you're living with high blood pressure, have a history of heart attacks, or often deal with chronic stress, please pause for a moment. Listen closely to your body. Because those subtle, unusual symptoms, so easy to dismiss, are your heart's quiet cry for help. I'm in danger. Here's something sobering. Every 40 seconds, someone in the world has a heart attack. And tragically, many of them never recognize a single warning sign before the crisis strikes. They think they're just tired. They blame it on poor sleep or anxiety. But in reality, blood isn't reaching parts of the brain. That area is starving of oxygen and nutrients, and thousands of brain cells die every second.